This meeting for the Health Human Services 1 o'clock agenda is coming to order. I'm the only one here right now, but this meeting is being streamed live on YouTube. In the unlikely event that we will have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, April 17, 2024 at 8:45 a.m. in room 225, different room. Your audio will be muted for those on Zoom and video disabled until shortly before it is your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed caption does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You'll find a link on the status page for the measure. We appreciate your understanding. Remind you that committee does have your testimony, that I reviewed them. So I encourage you to use your time to either add additional comments or you can stand on your written testimony. So first up is GM 747, nominating Marilyn Matsunaga for the Emergency Medical Service Advisory Committee. So first up, we have Department of Health. I see Debbie Morgan here. Please come on up.
Thank you, Chair San Buenaventura. Debbie Kim Morikawa, Deputy Director representing Emergency Services at Emergency Medical Services Injury Prevention System Branch. We're in strong support of the nomination of Ms. Matsunaga, and we did provide written support, but I'd like to ask a little latitude to just share a few words about my personal experiences with her. I've known her for about 25 years when we were both cohorts in the Pacific Century Fellows Program. This is when she was the SHPTA administrator. And she had tasked me to sit on one of her sub-area councils, the Honolulu one. And that's where I experienced just her passion for public service and her ability to really engage the community. She, and I'm going to read this because I trip up. She created one of the nation's first performance outcomes focused document for healthcare planning. And through that process, she was able to engage over 300 volunteers, including both community members and healthcare providers. And that's a tremendous number of people to rally around looking at the state health plan. As a committee member, I found it very difficult to go through the process of a CON, but she made it very structured and made sure that we understood the process and followed the criteria so that it was objective, and we were able to make sound recommendations. She was later tapped to sit on the be the executive director of the Workforce Investment Board. And there they looked at workforce issues, which is something that MSAC is really trying to wrap their hands around right now. And so I believe that her background there would really lend her as a superior board member or committee member for the EMS Advisory Committee.
Okay, thank you very much. Okay, next up, we have Kay Piltz in support. We have Kathy Ho, another first deputy, also in support. William Bailey in strong support. Okay, thank you very much. Okay, and anyone else wishing to testify in GM 747 on Zoom? Present? None? Marilyn, come on up. You can give us your statement, and you're not limited to 1 minute, so please proceed.
I do watch your hearings, and I do know you're very good about always saying that you and the senators read everything that comes to the committee. I'm very grateful for this opportunity to continue in public service as a volunteer of the Emergency Medical Services Advisory Committee, and I stand on the written replies to your questions that you sent.
Okay, thank you very much. Members, any question? We have Senator Kyoho Kolole also present. No questions? I want to thank you very much for putting your name up. I know it's difficult for Debbie Morikawa to come up here and be super passionate. She doesn't do that with everyone. I just want to make sure you know that.
Thank you.
And I see Jack Lewin here. Do you want to come up and testify in favor of GM 747? Come on up.
Oh, thank you. Jack Lewin from SHPTA. I just stand by the testimony that I put in that Marilyn was an able administrator of the agency back in the day, and worked with her for many years back when I was director of health. So she'll be a fantastic representative.
Okay, so thank you very much. So I do have just one question.
Yes.
What do you foresee in your term that you want to change or improve?
I would really like to work on workforce issues. I see in the news that they have workforce shortages, as do a lot of industries. So I would be very focused on seeing what kind of opportunities there may be and other innovative actions we might be able to take in Hawaii.
Okay, so thank you very much.
Okay, thank you.
Okay, so we do not have quorum, so I'm gonna move on with my resolutions. And hopefully you can call people coming for quorum. Okay. So next up, we have HCR 91, requesting the Department of Human Service to establish a working group to address issues relating to reimbursements and payments to home and community-based service providers. First up, Department of Human Services providing comments. Next up, we have Maria Corazon Cariaga, Big Island Adult Foster Home Operators in support. Wilfred Ashley Chang, ILWU in support. Rosemary Sebastian, ILWU. Sebastian's Arch LLC in support. Marty Rotunda, CCFFH in support. Paige Choi, Healthcare Association of Hawaii providing comments. 5 other individuals in support. Anybody else wishing to testify on HCR 91? Okay, moving on. Next, we have HCR 94, requesting Department of Human Services to conduct a study on the feasibility of increasing the Medicaid reimbursement rate for Hawaii's community care foster family homes and expanded adult residential care homes for Medicare clients every 10 years. First up, Director, Department of Human Services providing comments. Next, we have ILWU Local 1000, Sebastian's Arch, Rosemary Sebastian in support. Delia Kabinangan in support. Anybody else wishing to testify on HCR 94? I want to ask questions, moving on. HCR 172, requesting Department of Health to convene a working group to address issues relating to patient transfer and ambulance services and evaluate potential solutions. First up, we have Department of Health providing comments. Lauren Kim.
Good afternoon, Chair and Senators. The department requests deferral of this measure, and in exchange for that, we will commit to putting this issue on the next MSAC, Emergency Medical Services Advisory Committee agenda, and task that entity with working through these issues. Should this committee see it fit to move this HCR 172 forward, we request that MSAC be the entity that tackles this issue. All the experts are already there. It is well within their scope. It is authorized by the legislature and may report back to the legislature. And we think that's just a more efficient use of people's time and expertise would be to have MSAC already conduct this study and provide recommendations. So I'll stand by for questions.
Okay, thank you very much. Next, we have Hawaii Medical Association, HMA, Elizabeth Ignacio in support. Doug Flanders, Air Methods in support. Elizabeth England, I see you present. Hawaii Chapter of American College of Emergency Physicians in support. Please proceed.
Yes, good afternoon, Chair and members of the committee. I'm Dr. Elizabeth England, the president of the Hawaii Chapter of American Physicians, Emergency Physicians. I stand on our written testimony. We do believe that due to the kind of severity of the consequences that have come up from this issue, we really would like to have a working group assigned to this. Now, whoever takes charge, we're open to having discussions about that. But we have had patient deaths as a result of these delays. And so just to reflect the seriousness of the issue, we really would appreciate having a report from the legislature, but or given to the legislature for recommendations. But otherwise, we stand in our written testimony and are here for any questions.
Okay, thank you very much. Okay, next one is we have Tiffany Lightfoot, HCR 172. Providing comments. Please proceed.
Aloha, Tiffany Lightfoot for American Medical Response. We'll stand on our written testimony and we are available for any questions.
Okay, thank you very much.
Thank you.
Next, we have Ellen Hawai'i in support. Anybody else wishing to testify on HCR 172? So I do have questions. We have Matsunaga here for MSAC, who is up for MSAC. Come on up. I'm gonna ask you to. You heard Department of Health. They said that's gonna be first thing on your agenda should you be confirmed. Are you ready to put this issue as part of the agenda, which is basically relating to patient transfer, ambulance services, and evaluate potential solutions?
Yeah, I would really like the opportunity to have an orientation with MSAC. There are existing members on the committee, and I don't know what's happening with the Department of
Come on up,
Health. Yeah.
Ms. Morikawa.
We did just post the agenda, and the agenda actually does, it's a little narrower scope. When we developed the agenda, it was really based on the backlog of ambulances to the emergency rooms. Right now, I know that we've heard that a number of the emergency rooms are on 200 and 300% capacity, which makes it very difficult for patients to be dropped off. So they end up in the bays for several hours before an ambulance can be released. So that was an emergent issue for us. So that's why it was placed on the agenda. I believe in the actual bill, the issues that were covered are very expansive. And so and they're all interrelated in many ways, but a lot of it is hospital based. So while we do believe that we can address some of it, and we do need the other people at the table. And that's why I believe it was proposed that it could start with MSAC, because that would be immediate. It's a committee that's already in place. We would have to look at seeing what we could do to possibly coordinate a working group around this. I'll be perfectly honest, I don't totally understand all the sunshine laws, but the challenge that we even face with MSAC is with the sunshine laws, it really does limit some discussion because many of these individuals are related in their fields, and not to be able to discuss these issues outside of the committee meetings makes it very difficult. So I think that's why we're preferring that this be an informal working group as opposed to a legislatively prescribed group, so that we can have free discussions without having to sunshine an agenda, make sure that we meet the quorum. Sometimes when you have especially these important professionals that you want to be at the table, not everyone can make it at the same time. And so those are some of the challenges we face.
Thank you. So I have Lightfoot here. Could you come on up? Thank you. Thank you. So you heard Department of Health's concerns that they wanted more informally and put it in MSAC, and you heard that they're putting it as part of the agenda. Are you okay with that?
Yes.
Okay. Okay, so Elizabeth England, Beth England, are you still there?
Yes. I don't know.
Okay,
if you
so did you hear Department of Health and MSAC's commitment to hear it as part of their agenda, and their concerns that if it becomes a legislative working group, then they're gonna be a little bit more hampered because of sunshine law issues. Are you okay with us deferring it, because it looks like they've already put it in as part of their agenda?
So yeah, I absolutely understand the concern. I think it's a challenge just because she does mention it is extensive. There's more issues than just the ambulance delay. Because I agree with the air transfer and then actual acceptance of patients to hospitals. You know, more than anything. Okay.
I'm gonna tell you a personal story, and I see JC here because I called him up in the middle of the night because my mother-in-law had delays of a medevac transfer from Hilo Medical Center to Queens. So it wasn't just an air ambulance problem, because there was an air ambulance. The issue was more extensive because that one required an operating room availability, which they did not have because Queens is the only trauma center. So I agree that it's more than just transport. Okay, because I am health chair, and I'm hoping to be health chair again next session, I will hold Department of Health's feet to the fire because of my personal experience, because we do need to know about all of these delays, because I agree with you, Dr. England, that it could result in death, and it did result in death in my instance, okay? So, so I am concerned. Okay, thank you very much. Any other questions? Okay, seeing none, I'm gonna recess for a little while because I'm being told to do so, sorry. Recess. Okay, thank you. Recalling the 1 o'clock agenda for today, April 12th, 2024, HHS at room 225. 225, right? Sorry.
Yes.
At room 225. Okay, last resolution. HCR 187, requesting Legislative Reference Bureau to conduct a study on best practices for nurse staffing in healthcare facilities. Okay, first up, we have CR 187. We have LRB, Charlotte, providing comments. Okay, not present. Randy Pereira, Hawaii State AFL-CIO in support. Paige Choi, Healthcare Association of Hawaii, providing comments. Laura Reichart, Hawaii State Center for Nursing, providing comments. Rosalie Agassi in support. Ellen Awai in support. Anybody else on HCR 187? No one to ask questions of. And we are going to recess or adjourn for the 1 p.m. No, I have to say something. Okay, we don't have quorum, so we are deferring decision-making to April 17, 2024 at 8:45 a.m. in conference room 225 for this agenda. Okay, and with that, we are adjourned for today.